Gambler is a 12-year-old gelding who presented by his owner for blunt force trauma to the head. The owner indicated that there were 2 other horses who were with Gambler at the time he was in the pasture. The owner suspects another one of the stallions potentially kicked Gambler in the head, causing the head injury. Physical exam. Upon examination of Gambler, the veterinary noted epistaxis from the right nostril, which is bleeding. There was also swelling and alopecia along the right eye as well, as seen in the images. Constriction of the right pupil was noted that is consistent with the swelling seen. Atropine was given to dilate the pupils for better assessment. Radiographs were ordered for the right side of Gambler's skull. Taking equine photographs. Since most equine exams are performed in the horse's environment, and due to the large size of equines, radiographs are usually taken using a portable X-ray machine. The portability of the machine allows radiographs to be taken in the stalls, stables, or field without having to transport such large animals to a clinic. Portable machines vary in ease of use and their ability to utilize either digital or manual film. Since there is no table to use, the cassettes can be held in place by a cassette holder that can be manually held by the technician, or a vertical holder that holds the cassette in place like a stand. Reasons to utilize portable radiography in the equine patient. There are many indications for the use of portable radiography. Some of these can include lameness to assess the extremities of a horse. The use of radiographs can help in diagnosing several conditions and diseases. There is also the pre-purchase exam, where a potential buyer can have a horse examined for any injuries or flaws before purchasing or breeding. Progressive diseases such as osteoarthritis or traumatic injury can also be monitored utilizing X-rays. And finally, dental imaging can be performed on site when teeth are being floated or there are indications of oral injury, periodontal disease, extractions, or infections. Quality control considerations in equine skull radiography. To get a quality picture, keep the central ray perpendicular to the image receptor. This may be difficult due to the height of the horse and the weight of the machine. To alleviate this problem, the use of a stand may be helpful. Make sure the hair coat is dry and clean so that the image isn't blurred. Also keep in mind the exposure time for portable X-rays of equines is typically longer due to the need to penetrate larger bony structures. So always wear lead gloves, lead aprons, and dosimeter badges. Make sure the protective garments fit properly so they can shift when holding up the cassette holders or portable machine. To avoid any scatter radiation from a poorly aimed beam, use cassette holders instead of gloved hands to hold up a cassette. Special considerations for equine skull radiograph procedures. There are some things to consider when taking a radiograph of the skull using a portable machine. Since there is no table, one must remember to place the image receptor or cassette to the side of the body closest to the target area, and have the X-ray beam positioned on the opposite side of the skull. Keep in mind there may be some overlapping of structures due to the number of sinuses and bones that make up the skull. Remember to collimate and include the proper labels to indicate the position and side of the animal being imaged. To avoid any possible artifacts, remove the halter or try to use a rope instead of any metals. Also, flush out the oral cavity to clear any food or other items. To prevent blur and minimize head movement, sedation may be required. However, this may not be possible if neurological signs are seen. Here is an image of Gambler's skull before surgery. Notice the bone fragments on the cranioventral aspect of the zygomatic arch and frontal bone. Surgery and surgical positioning. As indicated in the photos, the animal is placed in left lateral recumbency and the animal's legs should be held up using support devices attached to the surgery table. Gambler was then anesthetized using gas anesthetic. Surgery included elevating the frontal bone fragments back into position and then stabilized with surgical wiring. Following surgery, Gambler was hoisted into the padded recovery room where he recovered smoothly. Final radiographs after surgical intervention. The surgery elevated the frontal bone fragments and stabilized them with surgical wiring as indicated in the circled portion of the X-ray. Recovery. Gambler was brought back to the hospital for a follow-up visit to evaluate his progress at day 14 and for removal of the sutures from his surgery. An eye exam showed normal pupillary light reflex and normal metastasal response. Radiographs were taken of Gambler's sinus to confirm that the surgical repairs were intact and healing well. There was residual fluid in the sinus, so Gambler was placed on antibiotics to minimize the chance of infection. Gambler could be turned out into a small paddock and begin light riding. His owner was able to start walk riding for 1 week and then gradual return to walk-trot work. In conclusion, upon Gambler's 28-day recheck, his head continued to heal very well. No nasal discharge was present, radiographs showed no fluid present in the sinus, and good fractal healing. Gambler was able to gradually return to normal work. After 3 months of healing, Gambler made a complete recovery, and his owner planned to show him in a couple of months. Radiographs have played an important role in the diagnosis and treatment of Gambler's injury. Having access to a portable machine made the process more efficient. The use of this specialty imaging also played a key role in his recovery.